say, this is what I think it is, here's how bad it is, or do you start at the other side and say, look, there's some things going on, and do you work into it gradually, or what's your recommendation on dealing with parents like that?
No, I kind of hit it head on, but the funny thing is that people know, and I don't know how to explain it, people know what's going on with their body. Like when they came in because they weren't feeling quite right, and then as you start to tell them and talk to them and you diagnose them with something that may sound awful, they'll, you know something, I haven't been feeling right for a long time. All of this starts to make sense. In emergency medicine, the thing I value most about emergency medicine is really allowed me to step back and take life in perspective. The things that people kind of choose to stress out about and worry about, you realize when you see both spectrums of life from birth to death, that it just puts things in perspective for you. We work hard to provide for our families. We work hard to get, homes or buy cars and material possessions. But, in my 12-year career, I've probably seen maybe between 100 and 200 people die. And on their deathbed, no one ever says, what's going to happen to my house? What's going to happen to my clothes? What's going to happen to all my material possessions? What people want is their family around them, and they want to know that, that their life mattered, for that period of time. And so I think that, that's one of the things of what I'm thankful for, what medicine has given back to me. And because my experience in medicine is so extreme, it's life and death, it's just allowed me to have a more broad perspective of our time here.
Wow.
It's kind of heavy for a high school
I was going to say, it got really solemn in here. So I don't need a new car now. I thought I did.
Yeah, and then along those same lines, we're talking about, you guys ever been to Killen's Barbecue in Pearland? If you haven't, it's phenomenal, and you'll understand why I'm saying that in a second here. So my son, I barbecue. I'm here in Texas, so I barbecue, and I do pretty good. Everybody that eats it likes it. But Killen's, you go to wait in line for an hour, and I'm planning to go back. I've already done it twice. I'm planning to go back again. It's amazing. So my 4-year-old son was chowing down. He had some brisket or something, and I had a beef rib and a pork rib, and he's like, "Oh, come on, Dad, you have two. Give me one." So I give him a piece of the beef rib. Well, it has some of the skin on there, and he starts to choke. And so at first, I'm like, what do I do? But then because I teach conscious choking to my students all the time, we go over it like at least once a month, and I've been doing it for years. I'm like, okay, well, keep coughing. And then instead of picking them up and doing the back blows right there, I pick them up and start to take them right outside because it's about 5 steps away. Then he spits it up right beside the table that was sitting right there. But, he starts coughing up. So like you were saying, the emergency action plan, not just sitting on the wall. If I had only trained in CPR once, it just going over and over it, so I take him outside and he spits up just a little bit and then he's fine and goes back to town eating barbecue and killing. And I would too if but just this, you got to be prepared, and the only way to be prepared is to practice. So the same here, we do the emergency situations once with the coaches a year. And, I was talking with one of the athletic trainers, and he was saying, I'm planning on getting one athlete from a sport just randomly said, hey, here's what you need to do today. You need to fall down on the court and pass out and that kind of thing. And then that way you see how they react. And the next time when it happens for real, they're not as surprised. And so, just being prepared, being exposed to it, going through the procedures like you've been saying the whole time, that, step by step by step, then like, oh, okay, now it's not a big deal.
That's exactly what I mentioned earlier, and with this group, is they're just so used to this air-conditioned room. It's quiet. There's no parents. There's no pressure. There's no mosquitoes. There's no humidity. And they're so used to that same scenario all the time, and that's all they practice in.
Sure.
I think that's brilliant. You have an athlete and let the coaching staff know. Maybe you even leave the gym and watch the panic ensue. And it's interesting. And then you come up to him and you say, I told you so. It's completely different. I mean, even if they did it 50 times, I still get nervous when I run out on a football field, just because I don't know what I'm expecting. But I mean, I hope to think that I can control this situation enough to take care of the athlete, but you just don't know what's going on. But it's different than when somebody says, okay, this kid's laying here with a spinal injury, take care of him. Well, you know everything already. And that's why head injuries bother me. Is it really a true head injury? Did he just get hit and he's got a little soreness on his skin? Is it a brain injury? Is there trauma underneath? Is there neck? There's so many things that may not show up. So I think that's the best way to do it, is throw him into a situation where it seems it's a practical situation, even though it's, obviously it's rehearsed or it's staged, but at least get them to see that, boom, this is real world here. You don't even have a crowd here. You don't have coaches. You don't have the mom screaming over your shoulder. And so from an athletic training side, that's the best way you can do it. And I know in the ER, like you said, you can't just go and randomly break a couple fingers and let them reset. That's your first real shot. I mean, other than, practicing on the students, but you don't know what's coming in the door in 2 minutes. And that's awesome. I mean, I wish students could do those kind of rotations to see a true laceration, not, a little cut and they got to take a steri strip and pull it across. But that's awesome for them.
I was just going to add to that. Another thing that's very important when you go through an emergency situation, things don't always go perfectly. And so after the whole experience is over, you need to pull your team together and do like a debriefing. Okay, what could we have done better here? It took too long to get this medication here. When you do those things, you're then able to perfect your process such that when the next situation comes in, you say, okay, we're now better prepared to handle this, so we're not so discombobulated, because certain supplies are not in the right place. And in the emergency room, a lot of it may be dictated on, you ended up putting the patient in the pediatric room because that was the only room available. And so nothing there is the right size for the patient that we're taking care of right there. So we now create carts such that if we need to move a cart to a room, no matter what room the patient's in, we have all the right equipment available for that patient, regardless of the room they've been placed in. And so those are little learning points you learn that you're never perfect. You're never perfect, and so you always have to strive for perfection, and that means reviewing your work, reviewing your processes, such that you minimize any mistakes going forward.
All right, so Dr. Lee, I know that the University of Houston Masters of Athletic Training program is already hooked up with Memorial Hermann, and they're doing rotations with you guys, and so they're going to be able to see some of those orthopedic injuries. But Dr. Allenye, how does someone? Well, one, how do we get people like you involved in our school? And then two is, our job as educators is to expose our kids to these things.
Sure.
So, obviously, I don't want to send high school kids following you around, but what's the best way for me to expose my kids to situations like that so that they are prepared if they're at a game at HISD that doesn't have a student athletic trainer, or a professional athletic trainer? So, in your opinion, what can we do there?
Same thing that we do in medicine. You're never going to be exposed to every single situation, but you go through mock scenarios and you say, okay, this is the situation. What are you going to do? And you change locales. Okay, you may hold, class in this forum because it's more video intensive. But then today we're going to go out in the athletic field and we're going to do simulation of someone being injured. And, you'll position people where they would be positioned on a game day or whatever. Put someone way on the other side of the field, and you're going to run out as a team. How are you going to handle this? You have to go through that to really be prepared, because life itself is never going to prepare you for everything. There's certain things as an emergency physician I have not seen, but I'm aware of how to take care of them. And a lot of it is regional. I trained in the Northeast, and so there weren't very many snake bites down there. We were trained for snake bites, read up all on snake bites. That benefited me when I came down here, because now I know and I see snake bites on a fairly regular basis. Another aspect of emergency medicine or subspecialty is cruise ship medicine, as well as wilderness medicine. And so those are things I have not been exposed to. But again, as long as the foundation has been laid, you then go through mock scenarios if you wanted to go into that environment, such that you would be prepared when you go out there. And again, the mock scenarios only prepare your reaction. It doesn't necessarily prepare you for what you're going to encounter, but you have enough foundation that you can adjust on the fly. It's kind of like there's this popular show on TV that I just got introduced to. It's called Naked and Afraid. All these people are survivalists, and they go out and they have to survive for 21 days. And some are hunters, some are fishers, but they never know what environment they're going to be put in. But they're survivalists at baseline. So when they get out there, they have to figure out, okay, I'm not near the water. There are no, whatever for me to hunt. How am I going to make it through the situation? And that's very much how I see, being an emergency doctor. I've been prepared for multiple scenarios, but if a scenario that presents itself that I'm not familiar with, there's enough foundation there for me to adjust on the fly to make the right decision.
All right, so someone like Matt, he's a licensed athletic trainer. If he wanted to get some rotations in the emergency room,
sure.
I'm sure Memorial Hermann may have something set up, but what would be the kind of the process for him to just follow you around for a day?
I mean, for it to be really high yield for him, I don't think a freestanding emergency room is where he would need to be to get the most benefit. He would learn about emergency medicine. This is how you take care of a kid that has the non-injury stuff, fever, might have appendicitis, chest pain, might be having a heart attack. Injuries by and far are not that common to say, okay, here is another injury. We got another injury. For him to get the most rich experience, I would recommend him be at, a bent-top type setting where people are coming in left and right, where, he'll even have his own patients because there's so many people there. There's enough to go around. If you really want to get a true experience. I mean, I tell anyone that's interested in trauma or injuries, you need to have an urban experience. You can't get that, being out in Sugar Land or in Kingwood. You're never going to get that stuff. You have to, you got to be where all the action's happening. And Houston, the 2 hospitals or the 3 hospitals, it's either going to be Bentop, LBJ, or Memorial Southwest. Other than that, Methodist, no. St. Luke's, no. You're not going to get that true traumatic experience.
I think
really
Bentop, that's where gunshots and car. I mean, if you don't see it there, then you're never going to see it.
Right.
In the athletic field, anyway.
Yeah.
All right. So then the first part of the question I kind of skipped over is, how would I get you involved in what we're doing here? I mean, we're partnered with Memorial Hermann, so
Sure.
we have doctors on the sidelines. So what would your role be in our sports medicine team here?
I think what we would do is we can get together and let's actually sit down and create some of those mock scenarios that I was discussing. The other thing, too, is that I'm a firm believer in that skill sets transfer. So you may learn something in one environment because it creates that experience for you. You can now apply it in a different situation going forward. So, for example, when I was a kid, my mother taught me some basic sewing, right? And so, but now that still helps me today as I learn to suture and sew when I'm fixing lacerations. So what I would want for the athletic program here is to have them develop clinical skills, practical skills that they can apply, that, they're learning it here as teenagers, but they'll remember, hey, I learned this in high school, and now I'm using it again in this environment. So, as simple as bringing some pig's feet. Let's make some lacerations and talk about different lacerations. Okay, this is what's considered a simple laceration that you can put steri strips on, or the glue, Dermabond. This is something you're going to have to sew up and show them the different layers of how you close something up. This is too wide. You can't just do a simple suture. You may have to do a mattress suture versus a deep layer closure. And so I think that's one of the things that when I was a student, one of the things that I valued. The other thing you can do, and I don't know how it works these days, let's have like a mini anatomy lab here. Let's bring in a cat or something, and we open it up and dissect it, a pig, and say, okay, animals and human beings are pretty much set up the same way. So you cut them down the middle, your liver is going to be on your right-hand side, your lungs are going to be here in the middle. It just shows them, okay, this is what the body looks like regardless of species. And so those are the things that stuck with me when I was younger, and I still carry those memories today.
Sweet. I like that. Definitely we'll look to set some stuff up to where you can kind of help teach our kids emergency situations.
Sure.
And, prepare them for whatever, because teaching CPR